Hello, Howard University. I'm looking forward to sharing with you about virtual reality. Over the next few minutes, we're going to define virtual reality, walk through a few examples, and then discuss where virtual reality might fit in the continuum of simulation. So, what is virtual reality? Virtual reality is a simulation of a physical existence in a virtual or imaginary setting, which a human sees through a headset. There's a growing continuum of what we mean by virtual reality. Augmented reality is using computer-generated images superimposed on the real world. And at the other end of the continuum is mixed reality, where, when using virtual reality, our other senses, such as smell and hearing and touch, are also engaged. An example of augmented reality is PerSim. This is a highly realistic hologram of a patient that a healthcare provider sees through a headset while in the real world, like an ambulance, as depicted here. One example of mixed reality is The Void. Here you are a rebel disguised as a stormtrooper that feels the heat and smells the ash as your skiff travels across to the base. You also feel the sting of blasters shot at you as your mission is blown. There are currently two ways to create virtual reality. One is with a 360-degree video camera, and this is usually used for exploring real-world experiences. The other is animation. This is when you need to create or explore a dynamic 3D world that may be fictional or dynamic, like a patient case. There are a lot of virtual reality headsets on the market that allow 3D viewing, such as the Vive, the Mirage, Google Cardboard, Oculus, or HoloLens, to name a few. But increasingly, the way that VR is produced, you can also watch it or explore it in 2 dimensions on a computer or cell phone. That concludes our overview of virtual reality, so let's pause here and give you a moment to write down at least one thing that you've learned about virtual reality so far. Let's now take a look at a few examples of virtual reality in health professions education. Virtual reality for anatomy, such as this example by Organon, allows learners to explore the human body in all dimensions and all planes. It even allows a certain level of dissection. Other types of virtual reality anatomy allow multiple users to engage with anatomy examples at the same time, such as this one by Medical Holodeck. Similar anatomy applications also sometimes incorporate some physiological elements as well as self-quizzing elements, as you can see in this example of the Physiology of the Eye by Intervoke. Increasingly, there's virtual reality that replicates full patient cases. This example by Oxford MedSim comes with 20 adult, 20 pediatric, and 20 nursing examples. The learner is in the position of the healthcare provider and has to move through full history, examination, investigation, and treatment. There is also virtual reality for empathy training. This example from Embodied Labs engages learners as a 74-year-old African American male who has macular degeneration and some hearing loss. As they explore the environment, they experience the macular degeneration that this patient has. Some schools are also using 360-degree video VR to create their own cases. Here's an example from the University of California, Irvine, where they created a Vietnamese clinic to help students embrace the social determinants of health and empathy. The camera that you see sticking out of the mannequin allows the learner to embrace the position of a patient who can't speak the language of the clinic, which is all run in Vietnamese. This helps learners appreciate second language patients in their own clinics. VR can also be used for resilience training. At the University of Colorado, our School of Dentistry uses an underwater exploration activity to help learners practice an unfamiliar environment with low control and low familiarity to prepare them for novel or unanticipated clinical practice experiences. It may seem obvious that different VR examples have different learning goals. Moving to the medical education simulation literature for a minute, we usually place the different types of simulation on a continuum of learning goals, ranging from specific subtasks or knowledge to composite whole patient skills like clinical reasoning. This can be helpful for thinking about some of the virtual reality examples like clinical cases or empathy training. Where would these fit on the current continuum? One possibility for patient cases is a pre-mannequin simulation experience where learners could deliberately practice clinical reasoning skills before coming to the simulation center. In this introduction, we defined virtual reality as a way of seeing or exploring a 3D world created with a 360-degree video camera or as an animation. We then walked through a few examples before placing these examples on a continuum. And now, it's your turn. Please find a group of 3 to 4 people and answer question 1. We'll come back together in a few minutes to discuss our answers.